Thank you, Chairman Haney. Last week on Wednesday, July 15th, we heard from the governor and the Illinois Department of Public Health Director, Dr. Ezike, on the resurgence criteria. As we look around our region, our state, we had to take a look at what would things look like if we needed to kind of roll back a bit. What would happen if cases surged in our area? Oftentimes I would hear, are we going to have to shut down completely again? What is that going to look like? And so with that, the state of Illinois provided a framework for implementation of additional community mitigation actions to be taken when there is a surge in COVID-19. The overall goal from day one has been continued, that flatten of the curve. The idea is that we do not get large spikes, that we may have increases, and then we come down again. The state is now divided into 11 regions as compared to the 4 regions that were initially identified in the Restore Illinois plan. And Winnebago County is in what we call Region 1, which is also consistent with our emergency services region, which makes sense as we look at hospital resources. So in addition to Boone County, DeKalb, Whiteside, Lee, Joe Davies, Carroll, Stevenson counties, and Paul Whiteside, we are in one region as we currently are for other types of healthcare services, because one of the big metrics as we look throughout the nation was the capability and ability of our hospitals to provide the care needed for both COVID and non-COVID, and to be able to surge as needed should we have an increased number of admissions related to COVID. But as we go through this, again, we're guided by the metrics. And the mitigation strategies will be much more targeted. I think that part of the concern is always people have a kind of philosophy, it's an all or none. These will be much more targeted mitigation strategies about where transmission is occurring, how it's occurring, and then what kinds of strategy can we put in place. I don't think at any of the mitigation tiers that have been proposed that we are talking about a closure or shutdown where we go back into shelter-in-place kinds of activities. But it will mean for our businesses, it may mean reduction in capacity, it may mean a reduction in hours, it may mean curbside only, it may be limitations if there's an outbreak associated, it may mean a closure if there's a particular outbreak associated with it. So this is why it becomes so important for us as our community to maintain ourselves, to continue to do what we need to do to help our businesses be able to remain open. In addition, as we look forward to opening the schools, and I think this becomes very important to understand. So what are the triggers? So I know that they reissued some new metrics, and I know that makes it very hard because of trying to find your metric on your page, is they are looking at sustained increase in the positivity rate. I've talked from day one that more testing does not mean necessarily an increase in positivity rate. So even as we increase our ability and capacity to test in our region, we're looking at the percent of positive tests that return. In addition, a sustained increase in hospital admissions or a reduction in our hospital capacity threatening surge capabilities. So I think those become those two that kind of go together. But overall, if our positivity rate is greater than or equal to 8% over 3 consecutive days, then our region will have to look back in with the state about how to address and put additional mitigation strategies on board. For those of you who have been tracking this all along, we do a rolling positivity rate in addition to what we call the 7-day rolling average. But at our peak, we were close to 17%, our positivity rate at that time. Our rolling positivity rate is 8%, but our average over 7 days is much lower than that. And that's what we're looking at. It's the current positivity rate. Will this be a decision that only Winnebago County makes? The answer is no. It will be a regional approach. And so we are all in this with our region partners and our fellow health departments and our fellow communities. We don't stand alone on this because we share a common resource, which is our healthcare systems. So again, those metrics will be posted on the IDPH website. And that is at dph.illinois.gov/region metrics. And I know you can take a look also at county level metrics, but the region metrics are these parts that are going as we take and we look at that framework for what kinds of rollbacks would we need to take if there was a resurgence in COVID-19. And I understand, I share the frustration. This is a long haul marathon, and we're having some sprints, and we're in the run again. Because it becomes so important. We're about a month away from many of our school reopenings. And for those of you who know and been watching, a month is 2 incubation periods, right? So we've really got to, I'm going to say, hunker down now and do what we need to do if we want schools to be able to reopen and be able to provide some in-person education. I've had the privilege to work with both Regional Office of Education for Boone and Winnebago counties and both the public and the private schools. We've been taking a look at the Illinois State Board of Education and the Illinois Department of Public Health guidance. And really kind of develop our community standards where there's options. What will it look like to return to a school in our community? Some general concepts, and I want parents out there to be kind of thinking about this. It's a process. Schools, both public and private, are working to bring children back to provide an optimal educational experience while protecting the health of the students, teachers, and staff. It is a tremendously large process and program that they are having to put together. Be clear that face coverings and masks will be part of the standard dress code. Understand that most sites will not be able to maintain 6 feet of social distancing at all times. I've heard that. Well, how are schools going to do that? The classrooms aren't large enough. Oh my gosh, what's going to happen? Understand that they are going to be using a concept called cohorting, which has been done through the summer camps and the essential daycare services and the daycares that we've been running up to this point. And especially in the younger and elementary grades where the teachers spend much more in contact time with students. But the idea being that cohort will be learning together, playing together, eating together, using the washroom together, so that the number of exposures and contacts is minimized. So it becomes a very important concept. So assigned seating for classes. I kind of touched on this last time. I know that that's a hard concept where we like to be able to move around. We've encouraged collaborative type classrooms, but now assigned seating or seating arrangements that are firm give us an idea of who's in contact, who's within 6 feet of the individuals. There may be assigned seating on the buses. Right? Bus capacity, very hard. If we told buses that they had to maintain 6 feet, we pretty much would not be able to provide transportation to education. And so we're really being thoughtful about that. Households obviously can sit together, but again, figuring out how do we assign the seating so if there's an exposure, we can determine quickly and promptly who's most at risk. Because remember, it's an individual who's within 6 feet for more than 15 minutes. Schools will be working us when a case is identified because we will identify what portions of the school or classroom or who's impacted. I want to make sure that people don't understand that once they hear about a case in a school, the school isn't automatically shutting down in its entirety. Similar to what we're talking about in some of the step ed and that tiered response is taking a much more targeted approach to making sure that we certainly quarantine those who were most impacted and isolating anyone who's ill. So oftentimes I know that will make people feel uncomfortable, right? Why isn't the whole school closing down? Why isn't the entire bus load of children being? Because we will explain that when we will be working through that with the school as well. But the goal is to ride the waves with remote learning being implemented in between in-person education strategies so that we can ride through this pandemic. There will be bumps, but we can handle the bumps. What we don't want is a trajectory that sends us to the moon. And I mean that from a very, positive way. The schools have worked very hard to get this so that we can make in-person learning a possibility because we know that many students need that touch point. Some of the offerings may be honored remotely. Things like when I think about they're trying to figure out how to do creative ways of art class and music class so that not only is the educational experience, it really is a broad educational experience. And again, knowing that it's out in the community, we cannot reduce the risk to zero, but we want to reduce the risk as much as possible. So what can you do right now as a parent or guardian of a student? Begin to prepare for the start of the school year. It's a month away. Check out the travel guidelines. If you plan to travel out of state, the state of Illinois, in the 2 weeks prior to the start of the school, Make sure that you're going to be able to back in time to quarantine if you're going to an area where there's high rates of case of COVID-19. You will be asked additional questions when you report your child's absence from school. This is not intended to violate your privacy or to know a lot about your personal experiences, but it's to make sure that we are identifying quickly and promptly any potential of COVID-19 in the school. You would want the same for your child as well. Be mindful of the work that schools are doing to cohort so that you also minimize contacts in the after-school hours. Think about the scouting programs, religious education, the sleepovers, the birthday parties. As the schools work very hard to cohort, are you doing the same to help in that effort? And prepare yourself for those waves where you may have to not be able to report to work. If your child's in a class that's being quarantined and you must now stay home, work and make sure that your employer is aware of your circumstances and situation. Pre-plan remote work wherever possible, because we are going to be riding those waves. We're going to have cases, and then we're going to have periods where there are no cases. But we have to be prepared for both scenarios during this time frame. So while the schools are preparing, parents, families, I need you to begin to prepare as we work through this process. When we said we were all in for Illinois, we're all in for 815, and we are all in for Region 1. And so it requires all of us. Help your child to learn to adjust to wearing a mask. If they've not been wearing a mask over the summer, begin that process. Have them wear it around the house. And also make sure that your child is ready for school with their vaccinations and school physicals so that they are ready and prepared to start the school year on time. You will be hearing more from the schools, and you'll be hearing more from me as we prepare so that you can understand what classes will look like, that what it will, be, the experience will be like, what actions and precautions are being taken to make the school environment a safe academic learning environment during the COVID pandemic. Pop-up testing sites. I want to give an update on some pop-up testing over the next 3 weeks, actually. The Illinois Department of Public Health will be providing free COVID-19 mobile testing over the from 9 a.m. to 5 p.m. at the following locations. I'm going to give you the first 2 weeks. We're working on the third week. Today, they were at the Winnebago County Housing Authority and Diagnola Garden Apartments in Rockton. Anyone from the public can go to that site, but we wanted to place these testing sites where some of our community members may have not had access to transportation to bring them to other locations. Tuesday, tomorrow, we'll be at Winnebago High School in Winnebago. On Wednesday, the Rockford Housing Authority will be hosting the testing site at Olson Plaza and North Main Manor. Thursday and Friday, we will be out at South Beloit High School for a South Beloit community. Saturday and Sunday, La Chiquita Foods will be hosting on South Main, the testing site. On July 27th, again, we'll be back at Rockford Housing Authority for Park Terrace. On Tuesday, the Winnebago County Housing Authority at Collier Garden Apartments in Rockford. On Wednesday, July 29th, we will be at Fairgrounds with the Rockford Housing Authority hosting us. On Thursday, July 30th, at Black Hawk Courts. On July 31st at Orton Keys. August 1st at St. Bernadette's Catholic Church. And on August 7th at the Grove in Rockford. So as you can see, we are trying to put pop-ups in zip codes and communities where we know individuals may not have had access to testing, or at hours they might not have access to testing. Anyone can be tested. Drive up, ride up, walk up, pony up, whatever way you want to come up. Any age will be tested. The only thing you need to do is provide a valid telephone number so that you can be contacted with your results. I know that that has been a critical access point at all points, some number where someone can call you with your results. You will be asked to provide an insurance card if you have one, but you will not be denied if you do not have it, because the state is trying to offset, obviously, if you can bill insurance, it's going to attempt to. And the citizenship question is not asked. So I want to be clear that this is open to our entire community. You do not have to stay in your area. If you want to go to another area and get tested and it's more convenient on your way home from work, please do at one of the locations. And remember that the number of tests does not trigger a tightening or restriction in the reopen. It's the positivity rate, meaning the percent of individuals that test positive. And too many of our community residents have not had access at all times for testing. So we're appreciative of that partnership, and we appreciate all of our partners who were able to stand up these testing sites on short notice. And again, we had little time to do that. We will be opening up the third week, and we'll be getting those dates out. And I know those dates were pushed out and the times and the exact locations through social media and the general media so that you can publish and post it. Again, with the idea that the community understands we are all over, and it's designed to be pop-up, right? So it doesn't stay there continuously. We are continuing to provide testing through the Auburn High School site, sponsored by Crusader Community Health. They are working to bring that indoors to another location because summer will not last forever. And so we'll begin that process of planning. And the College of Medicine Health Sciences campus is also continuing to host at this point for testing. So those sites are our more permanent sites versus pop-up testing. So as of today, the numbers for Winnebago County, we have 53 new cases. We now are at a total of 3,345. The positivity rate over our 7-day rolling average is at 2.6%, so well below the 8% that we are looking at if we have to roll back. Our recovery rate is 96%. We are not reporting any additional deaths. However, we are reporting another location of concern, which is Wesley Willows, who's on a second outbreak. So they went through 2 periods where they had none, and then they have cases. But again, we are in a pandemic, and we expect these waves to occur. And so it is incumbent on all of us to do what we can do to keep those waves as low and as ripples as possible so that our businesses can remain open, that our livelihoods are intact, and that our schools can reopen safely in the fall for the optimal educational experience.